have severe pain all around your shoulder that severely limits your shoulder external rotation, as well as limiting your shoulder abduction and shoulder internal rotation range of motion? If you do, you'll have what we call the shoulder capsular pattern. And you may have already figured out that this is a sign of possible frozen shoulder. In this video, I'm going to show you all the physical therapy exercises that I found for frozen shoulder after watching these 9 YouTube channels. To summarize all the exercises that these doctors, physical therapists, and personal trainer have mentioned, I put this here. There are generally 3 categories of exercises for frozen shoulder. First, massage or soft tissue or fascial mobilization. Second, flexibility exercises. And third, strengthening exercises. Before I go into the categories, I want to mention that I will be mentioning 3 phases of frozen shoulder here and there. Bob and Brad call the first phase the freezing phase, while E3 Rehab calls it high irritability phase. Bob and Brad call the second phase the frozen phase, while E3 Rehab calls it moderate irritability phase. Bob and Brad call the third phase undulled phase, while E3 Rehab calls it low irritability phase. Category 1, massage. 2 of the 9 channels recommend some type of massage, or soft tissue mobilization or fascial mobilization. Motivationaldoc and Dr. Christy Ennis both recommended fascial release with a massage tool. Motivationaldoc also recommended a manual myofascial release technique, while Dr. Christy Ennis also recommended the use of a tennis ball for rhomboid muscle release. My thoughts are everything is safe with the exception of the tennis ball or rhomboid muscle release. This is okay for the third phase because you will have low irritability, but not so good for the first phase, which is high irritability because you will be too sensitive for something with a lot of pressure, like a tennis ball. Category 2, flexibility exercises. All 9 channels recommended some form of flexibility exercises. This is also the only category of 3 categories that is recommended to be done in all 3 stages of frozen shoulder. There are 5 subgroups of exercises for this category. Each subgroup represents one of the directions of shoulder movement. Subgroup 1, flexion. The first exercise is the pendulum. This exercise is a good beginner exercise, especially for phase 1. It allows the shoulder to go from 0 degrees to 90 degrees by dangling. The second exercise for flexion is table slide. This is also a low irritability exercise and is very easy to do. It is gravity eliminated since you're not going against gravity. The more advanced version of table slide is the wall slide exercise. This is much more difficult because you're going against gravity. Finger or wall ladder exercise is similar to wall slide, but a little bit easier because you're using your fingers to assist with the movement. The use of pulley is an exercise that is actually pretty good from first to the second phase because it's an assisted movement. Shoulder flexion with downward supine could be a little bit difficult from 0 to 90 degrees, but from 90 to 180 degrees, it gets a little bit easier because it becomes gravity assisted, provided that you have the range of motion to go from 0 to 90. Shoulder flexion with the dowel in sitting position is a more advanced version of the supine version. This one, you're going against gravity the whole time, so it's much more difficult. It's probably better to do this when you already have almost full range of motion. This is more for strengthening actually because you're going against gravity. The Statue of Liberty exercise by Bob and Brad is a very interesting exercise. The use of a stick to assist with shoulder flexion in the sitting position. You almost use the floor at the same time to help stretching the shoulder. The standing lat stretch is a pretty aggressive exercise that stretches from 90 degrees to 180 degrees. Definitely not for phase 1, it's more for phase 2 and 3. Modified praying mantis in standing position is a similar exercise as table slide. Modified praying mantis exercise in kneeling is a more advanced version than modified praying mantis in standing because your body is lower. The child pose is an even more advanced version because it requires you to be almost at 180 degrees for the shoulder flexion. Subgroup 2, shoulder abduction. Pulley is an excellent tool to do assisted shoulder abduction. Shoulder abduction assisted range of motion with dowel is another common exercise. And both of these exercises can be done in the first phase. It's most useful when you have less than 90 degrees range of motions. It's a pretty beginner-friendly exercise. Subgroup 3, shoulder external rotation. External rotation is the most limiting range of motion out of the capsular pattern. Shoulder external rotation assists the range of motion with the dowel and sitting. This is a pretty traditional shoulder external rotation exercise. It is gradually eliminated. It takes some practice to get a good form because it's very easy to compensate by extending your elbow instead of rotating your shoulder with this exercise. Shoulder external rotation assists the range of motion with the dowel into supine position. It's actually a little bit easier because it's gravity assisted. So it's actually a good idea to do this one in the first phase. Shoulder external rotation assists the range of motion in standing at the door frame. While the therapists that Bob and Brad hosted on their channel actually recommend this one over the other two exercises because you're moving the body instead of moving the arm. Okay, subgroup 4, shoulder internal rotation. All the exercises for shoulder internal rotation mentioned by all the channels that I reviewed are not easy. All of them involve having your hand behind your back to start with. So you can do this various ways. You can use the pulley. You can use your other hand to assist with the movement, having both hands behind your back. You can hold the towel with both hands. You can use a good arm to pull the bad arm up behind your back. You can also use a horizontal stick, and you can also use a vertical stick behind your back. The shoulder internal rotation range of motion exercise is good for the second and the third phase of frozen shoulder. Subgroup 5, shoulder extension. Bob and Brad recommended using a paddling movement with a stick to do an assisted range of motion for shoulder extension. Category 3, strengthening exercises. 3 of the 9 channels recommended some type of shoulder strengthening. The strengthening exercise can be divided into scapular strengthening and rotator cuff strengthening. Scapular strengthening exercises include scapular retraction or shoulder squeezes and resisted shoulder rolls. Rotator cuff strengthening exercises include shoulder external rotation isometric and shoulder internal rotation isometric for the first phase, and then resisted shoulder external rotation and resisted shoulder internal rotation with a TheraBand for the second and third phase.